So next, we have Dr. Leslie Twilley from the Alberta Centre for Child, Family and Community Research. Leslie Twilley is the lead scientist with the Child and Youth Data Laboratory at ACCFCR. The CYDL links Government of Alberta administrative data to provide evidence to inform policy. Leslie leads the CYDL's research projects. Thank you, Leslie.
Hi, everybody. Thanks to Homeward Trust for the opportunity to be here today. And I'm going to talk to you a little bit about the Child and Youth Data Lab's longitudinal project. We are part of the Alberta Centre for Child, Family and Community Research. And what we do is we seek to improve child well-being by conducting, funding, and mobilizing research to inform policy with some evidence. And the Child and Youth Data Lab is the research facility within the ACCFCR, and we, as the title indicated, link and analyze administrative data from Government of Alberta ministries. So what kind of data do we have in this longitudinal project that I'm going to give you a very quick overview of today? We have province-wide, population-wide data. So we have over 2 million Albertans in this study between the ages of 0 to 30. We have over 50 million different service uses for those 2 million people in a longitudinal time span of 6 years. And that goes from fiscal year 2005-6 to 2010-11. 5 different ministries within the Government of Alberta provide data to us for this study. Those include advanced education, health, human services, and justice and solicitor general. So we have in total more than 20 databases. And for the individuals within the project, there are up to 225 different data elements on those individuals. So lots of data, big project. This is just a snapshot for you of the kinds of data, so it's a little hard when I say we have 225 data elements coming from 20 databases. It's hard to get a picture of that. This is just a snapshot for you. You don't need to focus on too many of the details here, but we have down the left different programs in the project. And then across the bottom we have years of age from 0 to 30. It's broken up by color into different parts of the lifespan. And what you can see within each of those rows is just a sample of the kinds of indicators that we have from different programs. So the Advancing Futures Bursary, for example, is a human services program that provides funding to long-term clients of child intervention services. And from that program we have details on the enrollment that they're in, what program are they taking in school and post-secondary, and what kind of support are they receiving. And you can go down and look through the programs. From the justice system we have information on the type of charge, a little bit on the history, age at first charge, for example. From the education system we have information on the educational achievement of students or the types of schools that they're attending. From the health system we have some perinatal indicators, things like were children low birth weight, preterm birth, for example. We have a mental health indicator for everyone in the project that's based mostly on services received within the health system, but also on services in other programs such as Family Support for Children with Disabilities, which is a human services program. So, and then you see the bottom row that says all programs, and those are what we call our key indicators that we have for virtually everyone in the project. So for everyone in the project we have information on their gender, their age, we have a socioeconomic status measure at the neighborhood level, that one's not at the individual level. Region of residence, and if it's available within the program, Indigenous status. So as you can see with a project with this breadth of data over a longitudinal period of 6 years, there are all kinds of different questions we can look at. And I'm just giving you here on this slide an example of some of the themes of the project. So we're looking at the experiences of Indigenous Albertans as one of our themes. We're looking at transitions between services. How do people move between the different services available to them from the government? Resilience is a strong theme throughout the project, so we look at resilience among, for example, socioeconomically disadvantaged populations, maltreated populations, people with mental health concerns, people who are homeless, and other vulnerable populations that we can identify within our data. Early childhood is another theme. Experiences of identified groups are part of what we're looking at in the project. So for example, for individuals with fetal alcohol spectrum disorder or autism, criminally involved. Those are just examples of the themes to give you an idea of the kinds of questions that we're working on for our ministry partners. Now, sometimes when we talk about this data, it seems like we have everything you could want to know. We talk about having 50 million service uses and 2 million Albertans over a 6-year time span. That sounds like a lot of data, but I do want to point out that there are some limitations. We only have administrative data, the data that are generated as ministries go about providing services to Albertans. We don't have non-administrative data. For example, clinics data is one example of the data that we don't have. So we have to keep that in mind, that we are limited to administrative data, the data that gets generated as a ministry provides its services. We tend not to have what we're calling here historical data, so the experiences of Albertans outside of our study period. There are some exceptions to that. We do have a few pieces of information about things happening outside of the study period, but in general, we're limited to those 6 years. A data gap that's really important is family information. We have limited information on the relationships that people are involved in, the household indicators, information about parents in the case of children. Those things, as many of you will know, are strong predictors of outcomes for children and youth and adults, and we tend not to have much in the way of those kinds of indicators. And as for, you'll see that we have lots of health data. What we have we have data from, for example, physician claims. So when a physician sees a patient, that physician makes a claim to be paid for that service. And there will be diagnosis codes in that claim that say, okay, I saw this person and I decided that perhaps they had autism. I sent them off to a specialist. So there will be a little check mark in a box, if you like. There's a code that indicates that they were seen for autism. That doesn't mean when they went off to that referral to the specialist that they were actually diagnosed with autism. We don't have that final outcome. We have the administrative data. So I just want to give you an idea of some of the limitations, because it does seem sometimes that we have all kinds of data. There are some things that are missing. So what about homelessness? What does it have to do with this project? As I pointed out before, we have a population of 0 to 30-year-olds, and the data that we have on homelessness is limited. We certainly don't have the entire homeless population of Alberta in this data set, but what we do have are people who encountered the health system between 2005-06 and 2010-11 who were coded as homeless. So they encountered the health system for whatever issue they were having. And during the coding of the event, there was a code entered to indicate that there was some kind of housing or homelessness issue going on. So that's the definition that we have in this project for the homeless population. So it will be an underrepresentation of the homeless population for sure. This is only going to include those who encountered the health system and received this code. But we can be fairly confident that these people are in fact part of the homeless population. They're just not the whole population. So what data do we have? It's this linked data that I talked about earlier. So we have data from these 5 ministries and over 20 different programs. If you participated in those programs during that time period and were between 0 and 30 years old, we have those data for you. And this will include demographic data, as I pointed out, those key indicators at the bottom of that chart, as well as the services, the service use data from those 5 participating ministries. So what are we going to do with it? What kind of analyses? The areas of focus for this particular analysis will be on health service use. So what are the patterns of health service use? Mental health status, child intervention history. This is the involvement in the child intervention system in Alberta. Educational achievement. How well did you do in the K-12 education system? And justice system involvement. Were you charged with an offense? Were you in the correction system? And the goal, as with all of the work in this project, is to inform policy and program development. So this includes human services programs, the Interagency Council on Homelessness priorities, and decisions and recommendations that are relevant to the Plan for Alberta Ending Homelessness in 10 years. So just to give you some a little bit more concrete examples of the kinds of research questions that we're talking about here with this population of homeless persons is, what is the profile of service use across Government of Alberta programs for people experiencing homelessness? Pretty simple research question, didn't take a lot of effort to think that one up, but of course this type of information isn't available to this point. So across the breadth of this many ministries with this many different services, we'll be able to create a profile now for individuals at the individual level of the kinds of services that they're using. And we can look at those demographics. For example, how does this profile vary with age or gender or mental health status? We can ask questions about the educational experiences of people who are homeless. So how are they proceeding, what are their trajectories through the education system? Are they ending up in the post-secondary system? How well are they doing in school? What factors are associated with educational resilience? In other words, staying in school. We can look at the justice system. How are different trajectories of justice system involvement associated with homelessness? And it says at the top, sample research questions, because that is indeed just a sample. You can imagine that we can take any of those different pieces of data, as long as we have the data, and answer all kinds of different other questions too. So this is just to give you a flavor of what we're doing in this very large project with this subpopulation that we have is some of the homeless population within Alberta. Now, what are the processes we use for this? How do we go about doing this research? First of all, the linkage is anonymous, so we don't know names or where these people live and so on. The linkage is done in a fashion that means that the data that we have, although linked at the individual level, are anonymous. The research is cross-sectoral in nature, so the idea is that we look at the big picture. So we're looking at all the kinds of services that are going on. And the research is always iterative. It's always back and forth. Okay, so let's form a question. Now let's find out if we might have the data to answer it. Now let's refine the question based on what we found out about that data. Let's go and do the analysis now. Do we need to change the question? And we consult all the way through. It's very collaborative. We're consulting at all times with our ministry partners in the course of that research, right from research question development all the way through to disseminating the results. It's always collaborative and iterative. That's the way we do it. What do we do with these data? As I've said already, our main task is to provide evidence for policy and program development. So the idea will be that the policies that get developed are actually informed by the data that are out there. Of course, we're also adding to the knowledge base. This is a unique project to have this breadth at a population level over a 6-year period. So that's a very important addition on its own, just to the knowledge base. Identifying data gaps is a big part of what we do. So for example, I brought some of them up earlier. There's a strong need for information on household indicators, the other things going on around people that predict their outcomes. And those generally aren't part of the business needs for ministries carrying out their business. So they don't tend to be collected. So the question would be, well, would you be doing better business? Would you be providing better services if you collected these indicators? So identifying those data gaps so they can be considered, so we can change the data collection that we do is an important part of our work. And of course, this can inform future research. Much of this work is groundbreaking. We haven't had the numbers before, we haven't had these data, and so this can lead to other questions and send us in directions for research. We have a knowledge mobilization working group that's tasked with making sure that this work is widely disseminated and used within and outside government. So those of you involved in research will know this is often a difficult step. Put all this effort into research, and sometimes it sits on shelves. We're very invested at the center in making sure that that information is actually out there, as widely disseminated as it can be, so that it can be used as much as possible. So I'll be happy to answer any questions or hear comments or suggestions during our breakout session. Thank you.